We also discussed public health, particularly regarding vaccination rates and the ongoing measles outbreaks in the region. With Dr. El-Sayed's background in public health, we were eager to hear his approach to rebuilding trust in medical expertise. How do you ascertain the distrust in public health?
Yeah, first it makes me really sad. We take for granted that we were vaccinated when we were kids and we didn't get diseases that are now resurging, that your kids and mine might be exposed to, right? You just had a baby, your baby is not going to be able to get a vaccine until 6 months at the earliest. And until then, you're going to have to really make sure that they're not exposed. We live in a community together and the choices that we make affect each other, or one another. But I also understand why there's so much distrust, and that's a function of the healthcare system we just talked about. One where you know that they're trying to make a buck off you. And so in the midst of COVID, we were watching as people who couldn't afford their insulin, a medication that they know they need for a disease they know they had, were now being offered a new vaccine that didn't exist a year ago for a disease they didn't yet have, right? And that's kind of weird when you're like, wait, where were you with my insulin when I was rationing my insulin, and now you're here with this new medication? And of course, that's going to kind of shake your trust in the system, right? So I understand where people are coming from when they think through the incentives in the healthcare system, which is part of why I want to fix this stupid healthcare system, right? I don't want people to go without their insulin, and I want people to trust that their healthcare is going to be there for them when and if they need it. But I think there's a confusion. There are people out there who have made a business out of selling people the lie that vaccines are what make these pharmaceutical companies money. In fact, from my standpoint, the issue with the pharmaceutical companies, and everybody who knows me knows I am one of the #1 critics of the pharmaceutical industry. The issue is not that they make medications to sell us for profit. The issue is that they don't make medications for the things we actually need. There hasn't been much innovation in the vaccine space before the mRNA technology that drove the COVID vaccines. That means that we've gone without vaccines for diseases that should be vaccine preventable. My issue is that they raise the prices so people don't get the medications that they make, not that they make medications that people don't need, right? And if you don't believe that vaccines work, ask your parents about what it was like, or your grandparents about what it's like to live in a world where their neighbors or their friends at school got polio and lost the use of their limbs from a disease that was vaccine preventable. I remember interviewing my grandparents for my podcast, America Dissected, about their experience lining up for the first polio vaccine. And their parents lined them up for hours and hours to get them access to the vaccine. You know why? Because they knew what polio could do, because they saw it. And I think in some respects, vaccines have been an unfortunate victim of their own success. We don't see the side effects of measles or mumps or rubella or smallpox or polio because we don't have to deal with them, because vaccines have been so effective in stamping them out. But I hate to say it, we're about to mess around and find out. And I worry about what that'll mean for a lot of innocent victims of the mis and disinformers, who always, by the way, have something to sell you on the back end. That's the thing, right? Everybody's looking for a conspiracy. Well, you ever realize that they've always got a website where they're selling you something when they tell you that vaccines can't be trusted? So that to me is a conspiracy. If somebody's trying to sell you the alternative to a vaccine, at that point run away and go get your kid vaccinated.